Hi, everyone. Welcome to today's webinar about Flex Program Evaluation. This is our fourth webinar in the series. And for both this webinar and the fifth webinar and the final one coming up next month, we'll really be focusing on bringing all the content together to design activities with outputs and outcomes in your program in mind. My name is Tracy Morton. I'm the Director of Population Health at the Center, and I'm the Program Director for TASC and SHIP. The National Rural Health Resource Center is a nonprofit organization that is dedicated to sustaining and improving healthcare in rural communities. We're the nation's leading knowledge and technical assistance center in healthcare, and we provide work in a lot of different areas, including supporting the Federal Office of Rural Health Policy with many of their federal technical assistance programs. Our series is a joint project funded by the Federal Office of Rural Health Policy that's being put on by TASC, the Technical Assistance Center of the National Rural Health Resource Center, and the Flex Monitoring Team represented here today from the University of Minnesota and the University of Southern Maine. And the purpose of this 5-part webinar series is really to help the state Flex program to deepen their understanding about program evaluation. So as I said, as we got going, today's the fourth webinar of this 5-part series, and each of the webinars has been 60 minutes long. The recordings are all linked there and in the link that Caroline dropped into the chat. All of them included some overview of really important content about the evaluation that we were covering that day, and then some engaging conversation and activities to apply that content. So today is our fourth webinar. The fifth webinar, we've had a new date change. And that will be on February 20th. You should have received information about that hold, and look for more information about the learning objectives and things like that coming in another week or so as we send out the kind of final announcement about that upcoming call. So with that, I'm really pleased to be joined today with both Megan Lahr and then also John Gale from the Flex Monitoring Team, who will be talking about the content today. So John, I'll turn it over to you to introduce the learning objectives for today.
Thank you, Tracy. Just wanted to go over a few things. Basically, we're going to talk about a funding cycle approach to Flex program activities. And we think this is incredibly important because you look at your projects and your activities over the funding cycle and try to create a more a coherent and a logically organized set of activities and projects. We're going to talk about classic predictive versus adaptive, which is change-driven activity in program design. We'll work on selecting output and outcome measures and talk about some examples of funding cycle outcome measurement across the 3 of the different Flex program areas.
Great. So in all of the webinars, we've tied together the content to how it relates with the core competencies for state Flex program excellence. So today's content really relates to the core competency of managing information and evaluation, and some of the proficiencies that are highlighted on the screen there in the yellow. Content today kind of relates a little bit to SMART goals, so we won't specifically be talking about those. Certainly relates to accessing and analyzing data. And then, of course, about using process measures or output measures and short, interim, and long-term outcome measures to assess your program's progress, plan for the future, and then how you can describe measurable outcomes for your state Flex programs activities that really demonstrate what it is that you're up to. So just like in all the webinars that we do here at TASC, and certainly in this series too, we're going to open up with a little bit of polling questions for you too, that help us evaluate the success of this event, but also to know where you're at too. So the first set of polling questions are about the learning objectives for today. So if you can take a minute to answer the ones here, they're about how you feel about your knowledge describing the classic or predictive and adaptive or change-driven activity design, your knowledge about output measures, your knowledge about selecting outcome measures, and about being able to implement outcome measurement in your state cycle. So take a minute to answer those, and we'll actually look at the results here together and once you're complete. Okay, so we're going to look at the results from this first set of questions. Drag it over here on the screen. So, and again, there's no right or wrong here. Hopefully today the content helps you to improve your answers to these, or gives you the path of knowledge to start to dig into the topics more, so that later on you do feel more confident in the responses. Whether or not people feel like they understand what the description is between classic or predictive versus adaptive or change-driven activity design and impact measurement, most people are either moderately familiar or slightly familiar with that. So that's the first topic that John will be talking about with us here today. Respondents feel like, for the most part, they're confident in their knowledge about selecting output measures, or moderately familiar with that. Selecting outcome measures is a little bit more of an advanced step and a slightly different change here where most people look like they feel like they're moderately familiar with that. And then lastly, being able to kind of apply your knowledge to implement outcome measurement in your state funding cycle. This is kind of a little bit across the board, but about a third of you feel like you're confident in your knowledge of that, a third feel you're moderately familiar, and a third feel like you're slightly familiar. So we've got a couple more polling questions here to get going, to further kind of dive into topic about what we're reviewing today. So Caroline, if you could put those up. All right, and so these today, oopsies, I'm so sorry about that. These questions look at whether or not your program designs activities with output measures in mind, always, to often, to never. Whether or not your program designs activities with outcome measures in mind. And then the last question, what are some of your biggest challenges for designing activities with outputs and outcome measures for either you or your Flex program? Just take a minute and answer those, and then we'll look at results for this as well. And that last question too, you can check as many of those as you feel fit. So whether or not your program designs your activities with output measures in mind, looks like most of you either always do that or often do that. So that's really excellent. Whether or not your program designs, activities with outcome measures in mind, kind of the same. You either always do that or often do that. And some of you are saying sometimes that's really lovely to see that nobody never thinks about that, because we definitely want to think about what our goal is in mind and if we can actually measure that goal. It's part of a SMART objective. And then lastly, what are the biggest challenges for designing activities with outputs or outcomes for you or for your programs? So kind of looking from highest to lowest here, a time to dedicate to accessing and analyzing data. We asked that in the previous webinar, you said that then too, and certainly we understand that. Next highest response is identifying needs from the data. So hopefully the webinar last time helped with that. If not, go back and listen to it, and any of our organizations are happy to talk with you further about that. And then other high responses are knowing where to find examples, knowing where to start, and other high responses include staffing as well. So thanks for taking a minute to do that. John, I hope that's some good information for you as you launch into your next set of content here.
Great, thanks, Tracy. So we're going to talk a little bit about activity and project design. There are really two ways to think about it, and most of us tend to fall into the first category, which is very predictive, traditional activity cycle design. It's also known as waterfall. And the reason it's called that is it's really cascades from one activity to the next. You're basically looking at the schedule, scope, and cost as defined at the beginning of your initiative. And it assumes everything can be planned up front and continues to move in a very logical fashion. It's basically plan the work and work the plan. It's sort of militaristic in some respects. The next way of thinking about it is really an agile or adaptive, change-driven design. And I think this is where most of us realistically find ourselves involved in project and initiative design. You've got to really be able to accommodate things that change that couldn't be identified during the project design. The components may be repeated from year to year, but could be adapted based on project activity and performance. Excuse me, allows for incremental changes. And it enables project activities and scope to be modified as necessary. The obvious example, which we all suffered through, was COVID. How many of you had your Flex program activities modified because the hospitals couldn't engage? Maybe some of the state agencies you worked with had different priorities and may have pulled you all in different directions as well. So next slide, please. So this is why we call it waterfall requirements. It really looks at starting with your requirements and then moving down through the steps. So requirements, design, implementation, verification, and maintenance. The requirement phase is really when you determine need, you estimate your requirements, and assess the viability of your project. Design phase, you determine your ultimate goals. You plan your schedule, you set up milestones, deliverables, and creating the design for the final deliverable. Implementation is when you get to the meat of the work, where you sit down and you implement, you engage the hospitals, EMS agencies, or others that you're working with. Your verification testing phase, you check to make sure the intervention is addressing those things that you plan to address. And finally, maintenance. As you come to the end of your project lifestyle and phase out, you've accomplished your goals. How do you phase out and move on to the next stage? Next slide. So agile development is really change driven. And I think this example I like a lot. So in year one, you're really setting up the implementation phase, project implementation, the assessment. Your assessment is driving what you're doing, who you're engaging, what the needs are. And then as you go to the next year, that cycle starts, and it maybe isn't a full assessment, it's much more of a reassessment. Have we accomplished what we intended to do? Are the hospitals or the EMS agencies finding it useful? Are they staying engaged? And then do that year to year as you look at things that we develop. You know, you could look at in a given state, does your state Medicaid, if you're in one of those states that hasn't expanded Medicaid, what if it does in a subsequent year? Is there things that change as a result of that? Will your hospitals be more viable? And understand, you know, this is a really busy and difficult environment. You have state health policy, you have national health policy, you have local economics and politics, all drive and can modify the things that you're doing. Next slide, please.
Sure. With this, we were just looking for a quick response to a polling question then again. So what's your project management approach? Do you fall more in the predictive or the waterfall style? Or do you fall more with doing agile or adaptive cycles? So if we can put that question up quick, Caroline, we'll see where people are at with that. Again, no wrong answer with this one either. You know what? I think that's okay. Well, why don't we use the chat? So go ahead and type into the chat what it might be that you, what you use more of. Do you use more predictive? Do you use more agile? What feels more natural to you? I can think too that there's sometimes that maybe I use both. And there's sometimes where I'm way more comfortable in a different space. I'd rather be doing this, but now I'm doing this instead. Sandy's got a little bit of both. John's saying more predictive, but adaptable is needed. Diana says predictive. Wow, a good mix, everyone. Yeah, so sometimes you have to adjust. I'm seeing your comment too, Stephanie, about adjusting to the data and what's more real time versus what you need to kind of be adapting to.
Well, and I also think it's important for the hospitals and the other EMS agencies and others that you engage with, that there's some consistency. And that agile and adaptive management doesn't suggest you're kind of ping-ponging back and forth across activities. Rather, you're making mid-course adjustments, mid-level adjustments as necessary to keep everything moving and achieving your ultimate goals. So again, I think there's a balancing act, at least for me as someone managing projects. How do we stay consistent? How do we we help our participants have something that they can rely on and engage in, and then adapt and modify as needed with their involvement.
Yeah, Jen, that's great. Penny Black just typed, she uses predictive until reality happens, and then she uses agile. I think that's exactly what you're saying.
Reality is an ugly thing some days.
Right. So we have another waterfall question for you here. Not waterfall like predictive, but waterfall like you're going to type something in the chat box. That's a response to what I'm going to put up on the screen. Then we'll all hit enter once I say to hit enter, but don't just type your words and hit enter. So what we're looking for you to respond to is this purple rectangle here. What resources do you need to improve performance management? So what comes to your mind when you think of that? What resources do you need to improve performance management? Type that in chat, hold on hitting enter, and we'll see what people say. This is really good information for us at TASC, at FORHP, at Flex Monitoring Team, at Arkita to be able to support you all. Okay, so why don't you go and hit enter? Let's see what you come up with. What resources do you need to improve performance management? Time, that's a good one. I like that, I understand that. Examples, easier data to access, some benchmarks, accurate data and time. I'm not sure we can solve the time thing, but maybe we can help with processes or tools or templates or whatever that help you make your work more efficient and effective that way. Performance measuring tools. Benchmarks and understanding using outcome measures. Great. Thank you all very much for doing that. Okay, John, back over to you.
Thank you, Tracy. So we'll just remind you of a few key terms because I think these are always important to keep in mind. Outputs measure that an activity has occurred, and it's really best to think of this as a stepping stone that you use to move forward. So an output can be anything from counting the number of participants in a meeting or a training program. These are the things that let you know it's important to manage. This lets you know that your target audience, your target hospitals or EMS agencies are actually participating and engaged. And an outcome is a measurable change that results from activities or a series of activities that form a project. And they can be short-term, intermediate, and long-term. And I would suggest that much of your outcome measurement should really be on the short and intermediate term time frame. And outcomes are things like changes in margins. It may be a capacity measurement. So if you're working with your EMS agencies to improve their ability to collect and report data, the fact that they're reporting data more consistently and accurately would be an outcome. Next slide, please. So we have outputs versus outcomes. Again, we've talked a little bit about this. You may have seen this slide before. So you're monitoring program activities and participation and engagement through outputs, the number of CH personnel who are attending a financial training, and the number of participants who report improved knowledge. And the outcomes, they monitor the benefits. So are you seeing the changes in margins, which might be a longer term measure, but you could also be looking at days reduction in accounts receivable, and which is a shorter term measure, and you should be able to, if depending on your initiatives, see changes in a much more rapid fashion. Next slide. So activities without outcomes, we've all talked about these before. We've probably will, you've heard this. So education in the form of webinars or workshops, the things that you do to engage your hospitals and your stakeholders, these generally won't have outcomes directly associated with them. There will be output. So you might do a webinar on changes in state policy or changes in Medicare reimbursement or Medicaid reimbursement in your state. Assessments, these are the things that lead to developing projects that have outcomes. You do an annual assessment. In some ways, it's a reassessment that provides information leading to needed changes. Some of the projects, which again, I think, excuse me, Penny, I saw your comment that projects are a series of activities that lead to one or more outcomes. No one thing is going to make a big change, but it's the activities that lead you stepwise to the changes, the outcomes, and the long-term outcomes and goals you're trying to collect. And these outputs are important. They really are something that you should monitor. If suddenly participants in a cohort stop coming, stop participating, you need to know that so you know what's happening and can make the necessary corrections. Next, please. So peer group meetings, this is one that so many of you do, and I think it's important because the participants find it helpful. But you may have a quarterly peer group meeting of CEOs and chief financial officers. Here in Maine, they do also peer group meetings for the nursing staff and the quality control officials, all very popular. And they share information, provide input into their needs for developing future state flex program activities, projects, and funding years. Changes in the rate of participation would be one thing you might want to measure. Percent of respondents who find the meeting useful. That's the pre-post surveys that you've all seen before. And it's also here, and I think Gale has reminded us of this in the past, that it's important to collect the anecdotal evidence, the stories of change and why these meetings have been helpful and how changes have occurred due to the information shared. So next slide, please. So here we'll go to projects, and I think again, some of us have been doing this for a while, so we'll try to really stay on the consistent language. So projects with outcomes. All activities aren't the same. Some of your activities and projects may not have outcomes in the first year. Some may have different outcomes to measure for each facility. So if you're looking at revenue cycle management, it could be one hospital's having difficulty with producing the invoices they need accurately from their EHR. Others may not be capturing the information they need to generate bills. So they might have different outcomes. And I think it's really important to be simplified, to simplify the process. The comments on needs are really instructive. Time is one that I think many of you have raised. So use best practice examples, best practices, some of the examples provided. Also look at, if you're working with hospitals in particular around financial information or around quality, look for measures that are consistent with what they produce on a regular basis. So we've calculated, we being the Flex monitoring team, more accurately, the folks from North Carolina, all the financial measures from the cost reports. But a lot of these measures, particularly for revenue cycle, hospitals will have this information, days in AR, their throughput, what their payer mix is. Use what they're already collecting. Try not to create something new that makes extra work for them. And then tailor the outcome measures to the phase of the program lifestyle. This is particularly critical. Early phases, focus on capacity building. Are they collecting the information as needed to bill? Is the charge master accurate? Are they coding properly? Do they have a process once they've generated a bill that gets rejected to review and resubmit? And these are the capacity building activities. Then later phases, look at the measures of performance, changes in AR, changes, the speed at which cash moves through the system, reduction in the time to receipt of cash. So look at the things that you can measure and improve and take them in a stepwise fashion. Next slide, please. So we'll look at projects with outcomes, and this is one I think that you may have seen before, but thinking about financial and operational performance improvement. If it were me, and I was talking to hospitals who were having some difficulties with revenue cycle, you want to start from the beginning. The first is really building the capacity. What's the charge master? Charge master reviews identify, you look at everything coding and it goes through the whole process and identifies and corrects errors and omissions in the charge master. This is really a foundation. So is the gross price per discharge accurate? And you can monitor over time the gross prices per discharge, which is a measure of inpatient revenues by total admissions, the price per visit, revenue per adjusted admission, net revenue per adjusted admission. If you're correcting errors in the charge master, these are things that will tell you that you're having an impact based on that work. Next slide. And this is where you're moving into actually working with the hospitals, improving that performance. Have you improved administrative functions, claims processing, and payment to ensure prompt and appropriate denial? So they should be monitoring for themselves the number of claims denied, the days in accounts receivable, the percentage of accounts receivable over 60, 90, and 120 days. There are some industry standards that you might be able to look at, but obviously monitoring the changes in the AR over these time periods is important. And a move from reducing the number of days in AR in 120 days to 90 or to 60, it shows you're moving in the right direction. Your net collection percentage, and net patient revenue per patient encounter. Next slide. So another project with outcomes, and that's improving patient and family engagement in a cohort-based model. So looking at some short-term outcome measures, capacity building. The number of the percent participation of cohort members in program activities. This is sort of bordering on an outcome, an output measure, but it shows that you're moving in that direction based on the cohort. And this percent improvement in participation surveys, measuring understanding of patient and family engagement metrics, how to implement them and why. Moving into intermediate term, and this is performance improvement, the number of completed admission checklists per critical access hospital, percent of completed bedside shift reports, percent of liaison engagements with patients and their family. And these are all steps in the process of improving engagement with patients and their families. And then the longer term system level performance is improvement in pre-discharge patient satisfaction surveys, improvements in HCAHPS scores by the hospital, as they get them reported, and increases in patient utilization. If you're doing a better job and patients are happy, are they improving the extent to which they work with you, use your hospital and its services? Next slide. Moving into the EMS program area, which is also an important one for many of you. Looking at various metrics, so short-term capacity, if you're particularly important when looking at time-critical diagnoses, these are STEMI, stroke, trauma, cardiovascular problems, basically heart attacks. So if it's capacity building, how many of your EMS agencies are equipped to perform 12 lead EKGs? You're not going to make much of a difference in outcomes if they don't have the basic capacity. How many of the percentage number of staff in an agency that are training, receiving training on recognition of stroke or STEMI, so that as they appear in the scene and respond to a call, they're able to quickly make these decisions and they have the training to do it. As you move to intermediate performance, which is at the agency level, how many patients and what are the percent and number of patients receiving percutaneous PCI, which is basically the angioplasty within 90 minutes from the first medical contact? And then long-term system performance, what are the reductions in inpatient mortality rates for patients treated for STEMI? So again, looking at these from year to year and over time, are they building the capacity to actually do the work on the ground? Are they seeing faster transports? Are patients getting from the field to the right location within 90 minutes? And long-term, what are the outcomes in terms of the system and patient level performance? Next slide. Another one in population health, and this is an area I can't tell you. I believe that almost every community health needs assessment that I've read has mentions in rural communities diabetes as one of their ongoing issues. So it's an area where I think flex programs have begun to do some work. So you're looking at prevention and management. So the capacity building, again, looking at the short term, are they using, it's the percent and number of CHs that are using patient registry to track their diabetic patients? If they're not tracking the patients, they don't have a day-to-day handle on who they are, they're not really probably going to be able to make as much of a difference as they can. How many of those patients, what percentage of them that are in the registry are receiving diabetic education? Intermediate, the CH level of performance, what are the percent and number of patients receiving HbA1c testing, eye exams, and all the other things that are necessary? Finally, are they using the electronic record? And this is why I think when you're doing this, they should be really staying at the patients that they have direct responsibility for. What's the reduction in the number and percent of patients with poor control of their daily blood glucose? And finally, at the system level, are you seeing reductions in emergency department use due to complications from diabetes for participating patients? Are you seeing your hospitalizations go down? Now, are you seeing a healthier lifestyle for those patients? So again, I think looking at it from step to step and thinking about building each one over time, bringing the hospitals up to appropriate level of capacity and foundation, then moving forward and monitoring those things again as you can, and think about it. And if you're doing this within a cohort, for example, be worth talking to the hospitals about what they actually collect. Again, we oftentimes fall into the trap of explaining to hospitals what they need and not necessarily asking them what they can produce for us. And I've been sort of seeing the comments coming up, and that data problem is the one ongoing challenge. Next slide. So a couple of tools to use. There'll be the new work plan template, and that'll be shared from the federal office as it's available for release. We have a document that has been out there for quite a while. It's just the Flex Program Logic Model that talks about theory of change. We have some briefs on financial and operational performance improvement, EMS and population health. And finally, the TASC Flex Performance Management and Evaluation Guide. These documents are all linked together and complement one another. You're not going to find inconsistencies across the board. We've been working carefully on that together as a team. And next slide. Questions?
Does anybody have any quick questions for John? John, I appreciate you sharing all those examples of outcome measures. I know it's a lot, and it probably for the audience maybe feels like an overwhelming laundry list of things, but they're really good references to go back to. And I think that they strongly support the concept of having projects where there's multiple activities that build upon each other to produce short, intermediate, long-term outcomes. And they also really support the concept that we've talked about in a couple webinars of using a cohort. There's efficiency and effectiveness in cohorts, but there's power. There's power in the sharing that happens among those that are participating in the cohort. And there's power in the numbers that are produced instead of just one hospital did this, which is always good. But 5, 10, whatever hospitals produce this, and this is their collective result, is a really great thing. So I'll stop talking for a second. Any questions for John?
I have a quick question. I think, I was seeing if we could get the links in the chat. So they're there. Thank you.
Yeah, absolutely. And the slide set will be available to you, and everything will be hyperlinked in the slides too. So you can use all those. Well, I'm going to move us along to our activity then. So we're going to break into small groups just as we have in the past. I won't go through the instructions now because each of your room's facilitators will do just that. But we'll be working in each room on the same exact mural space. So every group's doing the same thing. And we have a set of 6 questions to get through today. If you feel like your facilitator is nudging you along rather promptly, it's because they are. We have this mark that we'd like to get to today through step 3 of this activity, so that when we pick up with our 5th webinar, we'll actually be entering that same mural space again and picking up where we left off to finish up the activity. So we'll have about 20 minutes or so in our breakout rooms, probably come back into our main room with maybe 1 or 2 minutes remaining. We'll do some sharing if we can, but otherwise we do have some closing polling questions and announcements to you all for there. So Caroline's going to shuffle us into our rooms, and we'll see you all there. For doing that, I realized that we just took a lot of information there and said, here, react to this real quickly and have a good conversation. So thank you all for playing along and doing that. I recognize I'm not in full presenter mode here, but for the sake of time and me fumbling about, this is what we got. So posted up is the closing polling questions. We really love your thoughts and feedback about how today's content met the learning objectives for you. And if you're kind of at the same place or you feel like you learned a little bit more today, there's a 5th polling question in there about if you learned something today you'd like to implement in your program, and your overall satisfaction is the 6th question. We've alluded to this, but our last webinar in this series is on February 20th. We'll be kind of wrapping back up with all the content. And we'll be going back into that same exercise. So what you didn't complete today, we'll be going back into there, but we're going to shuffle all the groups about. So likely you won't have the same space, maybe you will. And probably not the same group participants, but that's okay. You'll be a new team to work together. Look at what's on the screen there, react to it, add to it, take somebody else's off of idea. If you don't feel like that's a good one, you want to do something different, that's great. And we'll just move forward with building out the remainder of that logic model, really getting into activities, figuring out the inputs, figuring out what the output is, the thing that gets produced because of the activity, and then finally what those changes are, those outcome measures based on the activities that you design. And that's how we'll close out things. So thank you all very much for participating. Thank you, John. Thank you, Megan, for this tremendous partnership to put these webinars together. Our contact information is on the screen. Please do reach out to us. We are more than happy to help talk through any of these nuances and little itty bitty details that make a big change. So reach out, and we wish you well, and we'll talk to you soon. Thank you all.
Bye.
Thanks.
Bye.
Bye.